Today we will discuss aortic aneurysms, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. An aortic aneurysm is a bulge or swelling in the aorta, which is the large blood vessel that carries blood from your heart to the rest of your body. Think of it like a weak spot in a balloon. If the pressure builds up, it can get bigger and potentially burst, which can be very dangerous. How to know if you have one? 1. Symptoms. Many people don't have symptoms, but some might experience sudden, severe pain in the chest, back, or abdomen, a pulsing sensation near the belly button, shortness of breath or difficulty breathing. 2. Medical tests. If you're at risk, like if you have high blood pressure, high cholesterol, or a family history, your doctor might recommend an ultrasound. 3. Regular checkups. Regular checkups can help catch issues early, especially if you have risk factors. If you have any concerning symptoms, it's important to see a healthcare professional. If someone has an aortic aneurysm, here are the simplified steps to follow. 1. Stay calm. Try to keep calm and reassure the person. 2. Call for help. Dial emergency services right away if there are severe symptoms like sudden pain or difficulty breathing. 3. Don't move much. Encourage the person to stay still and not to exert themselves. 4. Follow medical advice. Once help arrives, follow the instructions from medical professionals. 5. Get treatment. If diagnosed, treatment options may include monitoring or surgery, depending on the size and type of aneurysm. 6. Regular checkups. After treatment, make sure to attend regular doctor appointments to monitor the condition. Always prioritize getting professional medical help. In the hospital, here's what doctors typically do to help someone with an aortic aneurysm. 1. Assessment. Doctors will check the person's condition and symptoms. 2. Imaging tests. They might use ultrasound, CT scans, or MRIs to see the aneurysm clearly. 3. Stabilization. They'll make sure the person is stable, managing pain and monitoring vital signs. 4. Surgery. If the aneurysm is large or at risk of bursting, they may perform surgery to fix. This can involve open surgery, making a larger cut to repair or replace the affected section of the aorta. Endovascular surgery, using smaller cuts to place a stent, a tube, inside the aorta to support it. 5. Recovery. After surgery, the person will be monitored for complications and will need time to heal. 6. Follow-up care. They'll provide instructions for recovery and schedule follow-up visits to ensure everything is healing well. The focus is on saving the person's life and preventing further issues. Here are some common types of medications that may be used for managing an aortic aneurysm. 1. Blood pressure medications. Beta blockers, e.g. metoprolol, atenolol, help lower blood pressure and reduce stress on the aorta. ACE inhibitors, e.g. lisinopril and enalapril, help relax blood vessels and lower blood pressure. 2. Cholesterol-lowering medications. Statins, e.g. atorvastatin, simvastatin, help reduce cholesterol levels and improve heart health. 3. Anticoagulants, if needed. Warfarin or aspirin may be prescribed to prevent blood clots, especially if there are other risk factors. 4. Pain management. Acetaminophen or nonsteroidal anti-inflammatory drugs. 4. Managing pain if necessary. It's important to note that medication plans vary based on individual health needs and the specific situation of the aneurysm. Always consult a healthcare professional for personalized advice. People at a higher risk of developing an aortic aneurysm include 1. Older adults. The risk increases as people get older, especially those over 65. 2. Men. Men are more likely to develop aortic aneurysms than women. 3. Family history. If someone in your family has had an aortic aneurysm, your risk is higher. 4. Smoking. People who smoke or have smoked are at greater risk. 5. High blood pressure. those with consistently high blood pressure are more likely to have this condition. 6. High cholesterol. Having high cholesterol levels can contribute to heart and blood vessel issues. 7. Other health conditions. Conditions like Marfan syndrome or Ehlers-Danlos syndrome, which affect connective tissues, can also increase risk. 8. Sedentary lifestyle. Not being active can contribute to overall poor heart health. Being aware of these factors can help people take steps to reduce their risk. Now you need to watch my video on hyponatremia or have a look at otitis media.